Hi, doctor. Thank you so much for joining.
My pleasure, very much.
It's an honor to talk to you because I know you personally. You helped my sister deliver her baby, and they're doing absolutely fine. And she had a
Yeah,
complicated delivery, and yet you handled
yeah.
it so beautifully. And
Thank
anytime
you.
I talk about you on Instagram, I get messages from so many girls in Mangalore saying, oh my God, he is such a great doctor." Today we are talking about a topic which is important for everybody and not
Yes,
many have knowledge about it. So
yes.
when people ask me to do a video, I couldn't think of anyone else other than you who can speak about it and educate us all. He's Dr. Deepak Shedde, and he's one of the most sought after and most reputable gynecologists in Mangalore. I've known him for at least 3-4 years now, and I'm so happy to have him on this show where he'll talk and educate us about PCOS. But before that, doctor, can you just tell us a little bit about you and your experience?
Yes, I did my MBBS, my graduation from Belgaum, that is the JN Medical College. And then I did my post-graduation in MD in Gynecology and Obstetrics from Postgraduate Institute in Chandigarh. It's known as the Postgraduate Institute of India. It's called PGI.
Okay.
And after that, I worked in Delhi for some time, and then I was here in Mangalore at the Kasturba Medical College for around 11 years. Then I joined another college as a head department for a year plus. Now I'm attached to the KMC hospital and on the corporate side, and I have my private practice in Mangalore.
That's wonderful. Today we're talking about PCOS, and before you even get started, few are my personal questions, few are general questions, and few are questions which came through Instagram. So, but before we get started, if you could just help us understand what is PCOS in general.
Polycystic ovarian disease or polycystic ovarian syndrome. It's a diagnosis made by ultrasound and as well as the patient's symptoms and how she looks. So there are three components here. So one is what does the patient come to us with? And the commonest symptom a patient will come to us with PCOS is irregular periods. So it's not absolutely mandatory, but usually a girl with PCOS will have irregular periods. That is, usually girls have late periods. They'll also have history that they have a lot of hair on their face or on their body. They could have a very oily skin. They could have acne. They could have hair loss features. So these are things which tend to come along with PCO. You can also get a couple of girls will have dark patches on their back and other parts of their body. So these are the features of PCO. So what we do then is when we do an ultrasound. And in an ultrasound, we'll see the ovaries looking polycystic. Polycystic means the ovaries have a lot of small cysts in the ovary. Now, what are those cysts? Well, those cysts are nothing but our own eggs. So when people say cysts in ovary, it usually scares them, thinking that cysts are some tumors. Yeah. These cysts are nothing but our own eggs, our own follicular eggs, which she's supposed to have in her ovary. It's just that an ovary normally should not have more than one follicle growing at a time. In a polycystic ovary, a lot of eggs try to grow all at once. And that's why the ovary sort of becomes something like a traffic jam. Once we see an ovary looking like it's got a lot of eggs in it, that would be called a polycystic ovary, and a girl has got these features like irregular periods, oily skin, acne, hair, then we would do a couple of blood tests. We do on the second or third day of her period, usually empty stomach, and we get an idea about her hormonal balance.
Okay.
We also do a sugar test as well, just to make sure that there is no other features like diabetes, which is running in the background. We'll also find many of these polycystic ovary patients will have a family history of diabetes. It's extremely common to have a patient with PCO with a father having diabetes. And in fact, we have a lot of girls have come to me with PCO, and I've asked them, do you have a family history of diabetes? And they say no. And I say, why don't you have daddy check for his sugar? And they'll come back next week and say, listen, my dad, we found is a diabetic for him, and we didn't know that. And because you asked us, we've done the test to find it out. So this is usually what we see in PCOD. We see skin changes, we see period changes, we have ovaries which look polycystic, and we have a blood test to corroborate that risk.
So why does it happen in the first place? Is it because of hereditary where, the parents might have BP or sugar? Is BP also included in this, or like?
No, it's usually sugar. Like you said, there's a double component here. We have an environmental factor, like the way a girl's lifestyle is, but there's also a strong genetic component. So in the genetic component, you'll find usually, like I said, you'll find someone in the family would be diabetic. Not always, not necessarily so, but very often they'll be diabetic. And they'll also have some siblings, or the mother might have had something similar in the history. On top of that, we would expect the girl to have probably not a very good, healthy lifestyle, but not always, not necessarily again. But typically, if you have a girl who comes from a family history of diabetes, if she's not been very careful with her diet, if she's not been very careful with her exercise, she will basically go into a polycystic ovarian cycle earlier than otherwise. Whereas if she had been sensible with her food and exercise, it's possible she may not even get the disease. Her ovaries probably will look polycystic, but she will not have the disease component. That is, she will not have irregular periods and hair problems and fertility issues like difficulty to have children. But if she were to be a little bit careless with the diet and a little careless with the exercise, it's possible that a girl with a family history of diabetes will get into a PCOS system very early. And that's what we're seeing nowadays, especially from the Gulf return people. We find that the diet and exercise is not very good. We'll find a lot of girls seem to be going into a PCOS system very early. So we get 12-year-old, 13-year-olds girls coming with polycystic ovary. Whereas I remember around 15, 20 years back, typical polycystic ovarian girls used to be around 12, 13, 14, 15 plus 20s, 25. So now we're getting much younger than that. Yeah, as soon as they start off with their periods, the PCOS system seems to be starting very early.
Okay. Is there a difference between PCOS and PCOD, or is it's just the same?
Yes, yeah. Essentially the same thing. There is a Rotterdam criteria what we have to make a diagnosis.
Okay.
But if we can have a lot of girls with an ovary which looks polycystic and a few features of PCO, but they may not be actually suffering any problem from it.
Okay.
But they are the girls who, if we're careful with her diet and exercise, they won't get any disease process around it. She won't develop any problems later on because of the PCO.
So you were talking about the lifestyle and diet. What consists of this lifestyle and what consists of diet who might fall into this category of PCOS?
We know that the present day food, what people eat nowadays, has got a very high carbohydrate intake. So if you look at the foodstuffs, we have carbohydrate, which is like rice, which is dairy, which is fruits, which is sugars, potatoes. These are all the simple sugars or simple carbohydrates. And if you look at the non-carbohydrate foods, they would be the vegetables, they would be the meat, the non-vegetarian food, they would be the sprouts and there will be nuts. Now, these are the non-carbohydrate food. If you look at the type of food nowadays we find most people eat, we'll find that it's heavily lopsided towards carbohydrate. So when we have a lot of carbohydrates and they have a family history of diabetes, they tend to go into a PCOS because their energy levels in their body are just too much. Their body just don't know what to do with all that energy. So it starts a cascade, and the end result of the cascade is that the ovaries start getting a little confused. They'll end up producing too many eggs. And the end result of that cascade is that her body starts producing male hormones. And then she'll end up getting up all the hair problems and the hair loss problems. And that is, she'll end up having facial hair, and she'll also end up losing a bit of hair on the head as well. So a male pattern bald is what we call it.
Got it. Is having a cyst in itself, is it a different kind of disease, or is it only related?
A cyst is a very broad topic, wherein which anything round in the ovary which contains fluid is called a cyst. Now that could be a normal egg which a normal girl which she has in her ovary. So that's also called a cyst, what you call a follicular cyst. She could have a cyst in her ovary which is after the egg has ovulated. It's called a corpus luteal cyst. So anything round which contains fluid is a cyst. Also, you could have a malignancy. So even a cancerous tumor can be cystic. Okay. A non-cancerous tumor could be cystic. So cyst is a very broad, it's a basically descriptive finding of an ultrasound of what we see in the ovary.
Okay.
So in PCOD, it's basically an egg. It's nothing but a follicle.
Okay. What are the most common myths which may not be true? Like, have you heard of any uncommon myths which are or common myths which are not true?
Well, the commonest myth we find is that if a mother takes her child to her doctor or to any healthcare professional, or saying that invariably the information given to the mother will be that once she gets married, everything is going to be all right. And that's rubbish. Marriage is not going to have anything to do. In fact, we'll find very often girls who are not PCOD, once they get married, because with all the wedding hangama and the eating out and the lack of exercise and over carbohydrate food coming through, many girls after marriage actually land up getting PCOS. So they get pushed over into a PCOS system, which they were just having maybe a polycystic ovary, but they actually land up with a disease process after marriage. So marriage doesn't solve PCOD at all. There's no connection at all. The only thing which will solve PCOD is nothing but a better lifestyle. So just cut out your carbohydrates from your life, exercise like crazy, burn as much calories as you can, and PCOS system will be under control. Of course, it's not cured. So you must understand that polycystic ovary is not a curable problem. It's a controllable problem.
Okay, that makes sense. A few of the dermatologists, if you get acne, they suggest to do the blood work and the scanning on the second day of periods. So is it always only advisable to get this done only on the days of your periods, or can this test and scanning be done on any day?
Yeah, we would normally prefer to do scans during initial part of our periods. Because the eggs change, the ovaries change with the cycle. So we would like a benchmark by which we can compare with. So if you get a scan done within the first few days of a separate period, we know what an ovary is going to look like, and therefore we can compare. One. Second thing, the blood tests have to be done. That is what I'm talking about, the LH and FSH tests have to be done only on the second or third day of our periods. If it's done any other time of our periods, that test is valueless. And also, it's important that we don't give medicines to get her periods. So like, for example, you could have a girl who has a period once every 3 to 4 months. And because we need to do a blood test on the second and third day, sometimes medicines are given to get a period. And then the blood test is done on the second, third day of that period. But that particular blood test, again, useless, because that blood test is a response of a hormone given. Whereas we want to know what is her hormonal state, not the hormonal response of an artificial hormone given to.
Got it. And I've heard this is in the US, as to hear this, they would say that if you take birth control pills, it can control PCOS. Is it true, or?
Yeah, it's an artificial control. To an extent there is an element of truth there. But I give an analogy like, suppose you have a wall which is not very steady and not very stable, and if you lean on it, it will fall down. You have two choices. One is do the hard way, that is, you reconstruct the wall, or you reinforce the wall, you rebuild the wall. The second choice I have would be to just paint job on it. So very often these polycystic ovaries can be managed very easily with oral contraceptive pills, which gives you beautiful regular periods, temporarily clears out someone's skin and hair. But if she has not been dieting and exercising along with those pills, the minute you stop the pills, she's going to go back to square one.
Oh, okay.
So we would like, if at all I give a girl these hormonal pills, I'll make it very clear to her that she has to diet and exercise simultaneously with the pill, so that when we switch off the pill, she is fine on her own.
Yeah, that makes sense. Oh, wow. And what are some of the most common bodily changes? I think someone had messaged saying they are lean and yet they got PCOS. So is there some common traits apart from seeing acne, hair fall? Is there anything else that they might see? Yeah,
a typical classical picture of a polycystic would be a lady who's overweight. So what we would call an obese PCOD. You would have a girl who's actually very lean and also have polycystic ovary. So it's not mandatory that they have to be obese to be PCO. You're going to have a very much a lean PCOD. In fact, whereas a lean PCO patient would be a very difficult person to motivate to exercise and diet. So we find that patients who are lean tend not to be easy to convince to diet and exercise, and their relations also, the family will not be happy with her dieting exercise if she's already lean. But ultimately, the management of both is exactly the same. He has to exercise and diet.
At what stage of PCOS should we, visit a doctor, and how serious is this?
PCOS is actually quite a serious problem. It's a small component of a much larger disease known as a metabolic syndrome. And a metabolic syndrome is basically a patient who could, down the line, if not careful, could develop hypertension, diabetes, stroke. Some types of malignancies also are known in these metabolic syndromes. So PCOD is a small component of that. So it's very important that we catch our PCODs young, educate them on the correct lifestyle they would have to lead, and so that they will not be getting those problems as they grow older. So yes, it is a problem. So how soon should she come and see us? Well, as soon as her periods are not regular or she started to see any of these hair problems or acne problems, probably is a good time to come and visit a doctor and confirm the diagnosis and then go on to a very, very strict diet.
Okay. It is said women with PCOD will find it difficult to conceive or have a troubled labor. What is the effect of PCOS on age, fertility, and birthing process?
Because the ovaries have got too many eggs, all trying to grow at once, they don't ovulate correctly. And there's a hormonal imbalance in the system. So yes, there is an element of difficulty to get pregnant, but that's completely reversible with a very strict diet. And invariably,
I'm sorry to interrupt. If you have a regular period and yet have PCOS, will you still have trouble in conceiving? Or?
A little more trouble than a girl who doesn't have PCOD. But a girl who's got PCOD has got a regular periods tends to have a better pregnancy rate than a girl who has PCOD and irregular periods.
Okay.
We also find that PCOS patients who are pregnant after treatment, or if they have PCOD and they get pregnant, they tend to have a little more difficult pregnancies. They tend to have diabetes during pregnancy. They tend to have hypertension during pregnancy. They more complicated pregnancies, but not necessarily so. But we know that patients who have dieted well 3 to 4 months or 6 months before they got pregnant and controlled the PCOS system before they've got pregnant, they tend to have an absolutely sparkling pregnancy without any trouble. So that's a really good.
Okay. Is there a maximum age after menopause? Because you said as soon as you get your periods, a girl is susceptible. Does it mean that after menopause, the PCOS will disappear on its own?
So once the ovaries run out of eggs, she doesn't have PCOD. But remember, PCOD is just a part of a metabolic syndrome. So the metabolic syndrome component is going to continue. So her lifestyle control has to be maintained right through, even after menopause. So she will not have PCOD, but she will definitely be having the metabolic problems related to the disease.
Got it. Do you always need medication, or just lifestyle and diet and exercise is good enough?
Actually, yeah. I mean, most of my patients, they hardly are on any medicines at all. They just need to maybe of some vitamin supplementations or vitamin E supplementations, folic acid if they're looking to get pregnant, but nothing else. I mean, just diet and exercise. That's all they need. They normally don't require medicines.
When you say exercise, is it like cardio, or is there any particular style of exercise, or?
Anything is good. Okay, so I would never tell a girl, don't do this, don't do that. Okay. But the most strenuous, the better. So something like HIIT or functional training or something like that. But any kind of burn is good, including weights. In fact, we feel that if you do weight training, we find it's actually better.
Okay. And I think that brings an end to my questions. Now I'm moving on to the questions from Instagram, and I think one is already answered. The girl was thin and yet she was diagnosed with PCOS. So she just wants to know what kind of awareness. Is it just always related to acne, hair loss, or is there any other indication apart from the said list?
Yeah, that's it. I mean, if periods are irregular, that's a good signal. Okay. If her skin is showing features, that's a good signal. Of course, we'll always test thyroid disorders first. Okay. And that if the TSH is normal, then it's nearly always going to be a polycystic ovary.
Got it. One of the followers has been prescribed with, I don't know if I'm saying this right, Diene 35?
Diene 35, yes.
Yeah, so she's asking if there are any side effects to these pills or any of PCOS.
Yeah, there are side effects. There are side effects of Diene 35. It's a one of the components of a oral contraceptive pill. Okay. So definitely would help the girl's hair problem if she has any heavier facial hair growth. It also would help maybe to some extent any acne on her face. It will also get her periods regular. So all the cosmetic effects and her period effects of PCOD are going to be masked with Diene 35. So that's fine. But if she has not looked after her diet simultaneously, one day she's going to have to stop the tablet, isn't it? That's when she's going to get back the same problem. So it's very important that simultaneously her diet is looked after.
Okay. And can just the cysts delay the period? Also, getting periods once in 2 months, is it a symptom of PCOS or PCOD?
It's one of the components of, but you could have missed period due to many other reasons. So a girl could miss her periods due to change in her weight, change in her stress levels, exam times, marriage times. These are typical times when a girl could normally miss her period. It may not always be PCOS. So a girl missing a period doesn't mean she's always PCOS. So it's like I said, it's a syndrome. It's not only period irregularity. There are other components to it as well. Yeah.
Wow, I didn't know this. Okay. When is the best time if ovulation is late? I think it's best time to check. Is it on 21st day or 22nd day?
The best time to check for ovulation is 12, 13, 14 day if a girl is having a 28-day cycle.
Okay.
But if a girl is having a late cycle, then ovulation is very unpredictable. So it wouldn't be very easy to check.
They're asking is how to get rid of PCOS or how to cure it.
Ultimately, all we need to do is an unbalanced diet. So the component of a balanced diet is carbohydrates, fat, and proteins. So when a PCOS patient has to be on an unbalanced diet, so she has to cut out all simple carbohydrates, and she has to have only non-carbohydrate food. That would mean she has to eat only vegetables which grow above the ground. Mm-hmm. She can have all the nut family. She can have all the dals and sprouts family, that is the lentils. And she can have oils, that is cooking oils. And if she eats non-vegetarian food, then she could have that as well. Okay. But she cannot have anything with. So she cannot have rice, she can't have wheat, she can't have corn, she can't have any of the cereals families. She can't have any of the potato family. So potato, beetroots, carrots, sweet potato, none of the underground, the tuber family call them. We can't have any sugar, jaggery, honey, sweetness, cold drinks, none of the sugars. She can't have any of the fruit family, and she can't have any of the dairy family because that contains maltose, lactose. So unfortunately, this diet is not very easy to do, especially for the first couple of months. It's not culturally easy as well, because very few girls will have a family who will be happier with doing that type of diet.
So is there any replacement? You said no honey, sugar. Sugar, I get it, but then not even honey. So is there any other? And also you mentioned about fruits. So are there any substitutes which can be used in a day-to-day, which is more doable?
No, actually the diet works only when it's absolute.
Okay.
Once she has converted, that is, once she has reversed the PCOS cycle, it's a vicious cycle. We'll be introducing some of these foodstuffs very slowly and gradually in small amounts to top up any losses she may have had.
Okay.
But the initial 3 to 6 months, it has to be total absolute, and there are zero cheats possible in that. So there are no cheat days in this diet. It has to be 100%.
So if I get this right, no sugars, there's no fruits also? No fruits?
Every single fruit. Absolutely.
And no dairy, no wheat, no rice, potatoes.
Yes.
And anything underground.
Yes, underground vegetables, yes.
Oh, wow, that's a very strict.
No, but a lot of girls do it. You'll be surprised how many girls do it. And they are really happy with it. And their body changes, their skin changes, her periods come back to normal. They get pregnant easier. They have very comfortable, easy pregnancies.
Okay.
And it's remarkable. And when the change you see in a girl is fabulous. That male component which is in their body gives a certain shadow, you could call it. And the minute that she goes on a diet, 3 months later, they come back and see her. You can make out that femaleness come out through, that male shadow's gone. And that certain attractiveness which you see in a girl comes shining through. So the girls know that when they come back after 3 months of diet, they know that they've done a fabulous job of looking after their body.
Okay. That gives a hope. That gives a serious hope. One of the followers asked, during this lockdown, how can they contact you? So, or is there any other way, people who are not in Mangalore, to contact you?
Then we have a video consultation option available right now. So we're opening up a lot of video consultations, especially for things like PCOD and fertility, where I don't need to see them on site. We can't prescribe, obviously. But we can definitely counsel and advise, especially if they got reports. So video consultation in the period of lockdown, and probably in the future as well, is going to be a standard of management of care of patients. Of course, those who we have to see, we have to do a scan, we have to see them. But a lot of patients are going to be able to be managed easier with the video consultation. So that's definitely an option.
Okay. Yeah.
So they can easily get in touch and get to that.
Yeah, that's perfect. Thank you so much, doctor.
My pleasure.
With the current lifestyle, so many are facing all of this and we have zero clue as to when to go, who to contact. So this was really, really, really helpful. Thank you so much for such precious knowledge.
My pleasure.